Hello and thank you. This is great to be here. I'm here with Gay. We're from the National Academy for Social Prescribing. Gay's on our board and is a link worker, and I work on strategy. But we've got some fantastic people here to tell you about the offer that they have and what they've been doing to support social prescribing link workers and the wider workforce, and things that you can connect to that might be of use. So I'm looking right over there. We've got the lovely Najnin from the National Academy, who's supporting the offer for link workers. We've got Christiana from the National Association for Link Workers, who's been doing lots with link workers and is going to tell us more. We've got Nick Gitsham, who leads social prescribing from NHS England, where you've been doing lots of different things, and we're going to hear more about that. It's great to have Harminder Bains from Health Education England. Lots to tell us in a couple of minutes, and I'm going to be the bad cop who keeps to time and goes, "You've got 1 minute, guys," because we've got quite a lot to get to. But before I do that, I'm going to hand over to my fantastic co-chair, Gay. Tell us about link workers. Why are they important? What needs to happen, Gay?
Good morning, everyone. Any link workers in the house? Oh, we're going to try that again. Any link workers here? Excellent. The chances are the other link workers are actually busy doing the work. So that's why they're not here today. But I can tell you what is amazing and powerful about the role that we do, because this is what I do for my job Monday to Friday. As we heard earlier on in the previous session about the power of the stories. And that sometimes is the reasons why we get up every morning. It is quite frustrating and quite sometimes there are tensions, but to hear the thank yous and the well dones are simply quite amazing. To know that we're that listening voice, that confidant, that person that a person feels empowered to speak to. Someone even called me a counsellor. I was like, no, I have not got those qualifications. I don't want them. But the fact that she felt she was comfortable to come and talk to me so I could help her, that's the importance of the link workers. So link workers, if you're listening and if you do get to watch this later on, thank you very much for all the amazing work that you do. It has never gone unnoticed. Even today, we know the number of contacts exceeded what we thought we could do in a short 5-year period. We've exceeded that already. So that shows you the importance and the power of link workers. Now, as I said, you get the good days where it's like, I'm a champion, I can do all of this. And there's other days thinking, actually, I'd rather just go back to bed and start all over again. But what's really important about what we do is having these amazing teams right here supporting us. So while we're supporting the communities and the individuals, we're going to hear a bit more about how these amazing teams are supporting us as the link workers, developing the skills. We're emerging. We're very, very different. We're working in primary care networks. We're working in the voluntary care sector. We're working all over, but it's really important that our role is reinforced, that we're supported, that we're valued as link workers. I'm going to hand over to Harminder, who's going to start. Tell us more.
Okay, so thank you for everybody for having me here today. I'm a programme lead and I work in the primary and integrated care team at Health Education England. And what I'm responsible for is, and I'm not sure if you'll know, the additional role reimbursement scheme in terms of the education and training. Social prescribing link workers is one of those roles. And for me, I don't do anything in isolation. We absolutely need to hear that social prescribing link workers. So I'm going to just name a couple of things that we've done. When I say we don't do anything in isolation, we work really closely with NHSE&I colleagues, developing the educational curriculum to really support social prescribing link workers. So a couple of things that we've done, we've supported the competency framework. So that's something that's some of you may have already seen. So really acknowledging, not necessarily the qualifications that we're aspiring to, but also actually the lived experience, the experience that social prescribing link workers bring with them from previous roles from the voluntary community sector organisations. We've developed some online learning modules. We've got 11 of them at the moment, and that has been done with NHS England and is available. But one that's relatively new that I think is worth kind of sharing is the module around veterans' health. So actually the veterans have very distinct requirements, or they're a community that actually may require some specialised skills. So in terms of the social prescribing link workers, you'll find you're probably niche and specialised in certain areas. Our role is to listen, is to understand what some of the patient populations are, and actually how can we support in that education space. I speak about online learning modules. I'm an educationist by background, and I kind of didn't go through school, you know, plain sailing, completing my GCSEs in that form that, you know, achieving each and every year. Actually, vocational education was my path. So I'm really pleased to say that we've supported the community and the community health work. Community, I always get this wrong. A community health worker apprenticeship framework, which is available for social prescribing link workers and other personalised care roles. So again, it gives people an opportunity that haven't ever probably got a qualification, aren't necessarily interested in online learning modules, to actually access some form of education. And that then, for me, helps the social prescribing link worker gain qualifications if they want to, but also helps them in terms of that retention and having someone to have a conversation with, because like Dave says, you have your good days and you have not so good days. And actually that leads me on to the safe space to have a conversation. So we've heard quite a lot of stories, but actually what's the support that's out there for you in terms of that retention? Where's your safe space to have the conversation? And what we've done, and we're piloting at the moment, is this our training hubs, not all of them, so we've got 42 across the country, but they are pulling together group professional support sessions, and they are action learning sets. So there's a space for social prescribers to go to have a conversation about whatever it might be. And what we're hoping will come out of that is some training needs analysis to say, actually, there's a gap here and we need to do this. There's loads of other stuff that we do with training hubs, but I'm happy to talk about that later.
That's really interesting. I'd not really understood the power of those action learning sets, so that's great to hear about those. We'd love to hear more. Okay, we're moving on. Nick, tell us about what NHS England's been doing and what's important in this space to you.
Fantastic, thanks Bev, and it's brilliant to be here with so many partners that are helping us develop the fantastic social prescribing workforce. So over the last year, we've been really listening to link workers, to employers, to PCNs and to our stakeholders about how we can really add to the existing support offer, but also develop a more sustainable and professional approach to developing this really important workforce. We carried out a survey. We had over 450 link workers respond, and they overwhelmingly told us that they believed their job made a difference to wider determinants of health, and the majority would recommend their job to others. But they did say they had concerns about lack of supervision, line management, being part of multidisciplinary teams, and struggling to see their role being understood and valued. So we've been doing a range of things. So one of the big things we're doing is working with all of those stakeholders I talked about to develop a social prescribing workforce framework. So this will bring everything together for employers and those that direct the activities of link workers and link workers themselves to really set out how to understand the role, how to maximise its impact, what are the key competencies, and what are the support structures that must be in place to help this flourish. We're going to be sharing this. We're doing it in a very collaborative way. It's going to be up on our NHS collaborative platform over the spring. We're putting the first bit out next week, which is the competency framework. We'd really like people to comment. The other thing is we've been adding to our existing offer. So the e-learning working with HEE. We've also just launching this week a children and young people's module. We've done a module on supervision this year, which is really popular, and we're about to do one on culturally responsive practice. We've got our fortnightly webinars. If you haven't listened to them, we've got great backlog and back catalogue. Really encourage you to have a look at that. This week's was on population health management, workforce development. Working around HEE training hubs, and we've got our fabulous regional learning coordinators and primary care advisors that are out there to support people to make a difference. We've been working with National Association of Link Workers and with NASP, and they'll both talk about some of the things that we've been doing there, and continue to work with primary care on some of those wider issues, such as clinical governance and multidisciplinary working. So our call for action really today is for social prescribing link workers, their managers and everybody interested in the development of social prescribing to join us in developing this workforce development framework, and do that by joining the collaborative platform at NHS England, which we'll share and tweet widely through this event. So,
wow, that's amazing. That's 4 minutes. That's a brilliant summary.
I was warned.
Thank you. That's great. Go on, Gay, you introduce our next participant, please.
So our next participant, who is going to share a little bit more about her work, is, what's the name? Christiana Melam. Sorry.
I can't believe you forgot that.
Sorry.
I've been championing you guys and you forgot my name.
How can we forget you, Christiana? You are an amazing leader. Tell
Anyway,
us more about what you've been up to.
Okay, so when I go to speak at these events, I feel that it would not happen if we didn't have social prescribing link workers. So I think it would be wrong if we don't give them a round of applause. So can we do that, please? Thank you, thank you. So social prescribing link workers are leading on a groundbreaking transformation in terms of how the healthcare system is being delivered in this country and also globally. So I think we should understand that this is groundbreaking. It's not fluffy stuff. So we are driving change and we need everyone to be with us with that change. This is about social justice and about inequalities. So by increasing the number of social prescribing link workers, we are tackling inequalities and social justice because it is a role that values lived experience. So we cannot be having a healthcare system that is not representative of the population that it serves. So, like you would expect, there is burnout issues. So the pandemic has highlighted the need for social prescribing link workers and people are recognizing the impact that it has. So it's good that we have commitment to have more social prescribing link workers, but we need to recruit more. So my call to everyone here is tell your families, tell your friends, your partner, your dogs, your enemies, everybody that is interested in becoming social prescribing link workers, help us to actually spread that word. A lot of people don't still understand what social prescribing link workers do and don't just feel that it's just the people on this panel, it's not just our responsibility, it is a collective responsibility to help people to understand the role that they do. It is a collective responsibility to make sure that social prescribing link workers actually succeed, because we've tried so many things, patching people up. James covered in his presentation where we are focusing in a downstream service where it's almost like a crisis. You need to get to the crisis point before you get help. Social prescribing link workers enables the community to influence health and well-being. They enable patients and communities to be the ones driving the change. It validates the contribution that communities play in health and well-being. So all the stories we've heard and all the things we're hearing today, it's not fluffy stuff, it is evidence-based. Interventions have not been working correctly because we don't have a social prescribing link worker who is able to remove those barriers, who is able to advocate for people, who is able to drive the social policy, who is able to say, this person matters, what matters to them is important, who is able to make people feel valued, and most importantly, to make sure that underserved communities and people that are facing social injustice actually have a voice. So it's very important to understand their role in advocating and driving change. Now we do have issues. It is a transformative program. So there are issues around supervision. There are issues around education and qualification. Yes, some people come into the role with prior qualification. Some of them don't have the qualifications. They've come through their lived experience. But we do have a collective responsibility to make sure that that contribution is validated. We do have a responsibility to social mobility through the social prescribing link worker workforce, not just supporting people, but actually bringing in those diverse communities. So I would like to see more diversity in the social prescribing workforce. We need to apply an EDI lens. We need to make sure that we are taking down barriers. It is something that requires creative disruption. We cannot just be using traditional recruitment strategies. I want the NHS jobs to stop advertising social prescribing link worker jobs there. Go to the mosques, go to the churches, go everywhere, go to the streets and call on people to become social prescribing link workers. So it's for you to go out there, advocate for them, advocate for what they need. If you actually have got community assets, you've got things, set up groups and just be making noise. Write to your MPs, send them messages on Twitter, say yes, they need support, they need to have qualifications, they have educational needs. What can you do? So the national partners have got some things that they can do. What can you as a link worker do? What can you as the person listening online, the person in this room, you on Twitter, how can you help us? How can you help this social revolution on well-being? It's not just for me to actually solve. How can you help us to drive the social injustice, the inequalities that is driving this nation to a halt? What can you do about it? It is by actually standing with social prescribing link workers. It is about what you can do as an individual to make sure that their needs are met, to make sure they're not suffering burnout, to make sure that the 4,500 commitment of social prescribing link workers, which that money is about to go now, we've only got a few more years to utilize that funding. Go and advocate to the primary care networks. Go and advocate to the local authorities. Go and advocate to your MPs. Go and advocate to the integrated care system to make sure that we protect this workforce. We must protect them. We must protect them for yourself, for your families, and for the people they serve. Thank you.
Wow. Okay, we love your passionate commitment. That's amazing. Thank you. Najnin, tell us more. I know that's quite a hard one to follow, but
Thanks, Christiana.
you've joined the National Academy for Social Prescribing and you're coordinating support for link workers. Tell us a bit more, please.
Yes, actually. So I'm going to start off with the champions, actually, just because it's fitting since all that passion that you're talking about. And we are talking about a social revolution of change. And so Social Prescribing Champions, if you haven't heard of it, it's currently a pilot with the official launching on the 9th of March, so next week. And it's a joint collaboration with NHS England, and Bogdan over there has been leading on it with Julie Lowe at NHS England&I. And it's a programme of champions. So it's more about providing link worker allies within the healthcare system. So it's not just about primary care, it's thinking about secondary care as well as community settings. What's really important and I think really amazing about the champions is that it's not just open for clinical workforce, it's also those non-clinical workforce that are really essential and core members of our healthcare system. So people like discharge coordinators, the front of house at the GP receptionists, which have a wealth of information about our patients in the service. So do spread the word, and you can, I did have some slides, so do follow Bogdan, and if there's any information, do contact him directly. But applications open on the 9th of March, so do spread the word. I'll move on to the portfolio of evidence. So we've been commissioned by NHS England and Improvement to work on to develop a portfolio of evidence for link workers to evidence the broad range of their practice, so their skills and the competency framework, and that's in line with the competency framework that NHS England and Improvement will be publishing quite soon, so do have a look out on that. And so we've had over 60 link workers and supervisors live test these materials, and we've created a suite of materials which include an observation tool, a reflective practice, we have some case study templates as well as feedback surveys, all sweet together in a portfolio, and the feedback has been overwhelmingly positive. We've had link workers across the country from different regions, from different employment settings, and there's definitely an appetite for this to be welcomed and used in practice, which is really positive. What we've seen, one of the main, which is not surprising, is the lack of protected time for link workers to have, particularly around reflective practice, and we know that that's a core element of clinical roles, and so this should be encouraged for those non-clinical roles as well, and not just link workers, but everyone that has a patient-facing role. And so with that will come some guidance on how to use those tools in the portfolio of evidence. We'll also have some guidance for supervisors, the workplace supervisors, on how to familiarise themselves with the role. We recognise that there are lots of people within the primary care settings particularly that might not be familiar with the link worker role. Often it's confused with the social worker role. I think the draft competency framework will help sort of cement that, what that role is. So some exciting things to come and look forward to soon. So we aim to publish that for link workers to have readily available by early April. We're just in the editing phase, and so yeah, watch your space. So remember, 9th of March for the social prescribing champions application forms, and keep an eye out on our website for the portfolio of evidence.
Thank you very much. That's a brilliant summary of lots of different aspects of the link worker offer. I think these fantastic people have been working incredibly hard to knit it together individually and collectively, so that's great. Can I just, we've got a few minutes, you may have a question for any of our panel, but we've only got 2 microphones. We haven't got any roving microphones, so if you want to ask a question, I'm going to ask you to put your hand up and then come to the front so that you can ask the question into the microphone. Otherwise, people on Zoom can't hear it. So, anybody want to ask a question to any of our panel? Okay, brilliant. Could you come to the front, please, and just ask your question?
Guinea pig here.
Thank you very much for being a guinea pig.
That's all right. Giles Woodhouse. I work for Wessex Archaeology. I'm a veteran and I spent 10 years working with the military community in a professional capacity. So first, thank you for doing that module. But my question relates to a point, Harminder, you talked about providing, I think, supervision support for your link workers. Is that resource something that you can share with those that are actually delivering the social prescribing programs? Working across the heritage community, York Archaeological Trust, Mola here today, it's something we've identified. I think that certainly you're talking about voluntary groups, small charities, they probably can't develop this themselves. So if we can have that support from a body like yours that's done a lot of work and research, I think that would be a really powerful, helpful thing to do for the practice community.
So absolutely. Am I okay to respond? Yeah,
Yeah, of course, go for it.
So absolutely. It is in pilot stage in terms of that professional support, and that will come to a close sort of March, and we'll have a look at the findings, but I will absolutely feed that in. Happy for you to get in contact with me so I can make sure that we're connected and we are supporting.
And perhaps just to add, I mean, Harminder, the HEE supervision module that we developed with you, that it's available through the Personalised Care Institute and through HEE, and if you join the collaborative platform at NHS England, good way to find, what's the latest and get the bulletin of what's out. But that's available for everyone to look at, and is incredibly popular at the moment.
Yeah, it's free, isn't it?
It's free. Yes, sorry, all the HEE modules are free. Online learning. Yeah.
Okay, thank you. I'm going to just ask if we've got time for one more question. Does anybody else have a question? If you don't, oh, brilliant. In the middle in yellow, please. Thank you.
Hello, hi, I'm Esther Watson. I work for the National Academy for Social Prescribing as a South East Thriving Communities Regional Lead. I'm really interested, I see the financial social prescriber, a heritage social prescriber, all different specialisms, and I'm interested in how we're going to have is there a vision of how these amazing roles and the specialism are going to fit together in places? Sometimes it feels like, the good practice is here, and you think, oh, they've got that, we haven't got that. It's a really difficult question, I'm really sorry, but I'm really interested in what your vision for the future is. Yeah.
Thank you, Esther. Do you know, I'm going to start with Najnin, because Najnin's led social prescribing schemes in London. Now, tell us more, Najnin, about how do all those specialists and generalists fit together?
So I think there's so many different examples across the country, and not just London. So in terms of NASP, we're actually creating some case studies in terms of how we might incorporate specialisms within a hyperlocal level, looking at population health data, and that's informed decision making in terms of all the R's recruitment roles. I think there's also, I think that will support on going forward the next rounds of R's recruitments. There's also, I think there's so much with the portfolio of evidence as well, because it's such a broad range. Even if you do have a specialism, the skills and competencies and the behaviours that come with that, I think it's such an opportunity to have that documented and for link workers to reflect on their practice and to really tease out those skills that we don't necessarily have anywhere currently. And so that's why the portfolio of evidence is really important and will be heavily encouraged to use. And we also want to make sure that there's protective time for link workers to evidence and reflect on their practice, because it's such an important practice. You know, we are seeing link workers burnt out as core members of the primary care team. Primary care is just, you know, we know it's just struggling at the moment. So this is hopefully a tool to arm them with, to sort of help them build confidence.
Thank you. Can I just bring in Christiana first, and then I think you might all, this is quite a popular topic.
Yeah.
Christiana, tell us more.
I think that's a good question, and I think we should be very careful with the way we describe social prescribing link workers' role, and we need to understand how things actually work, because I mean, we are about professional standards and competency and continuing professional development, and we've got a code of practice. So what we want is a baseline. I mean, you don't just stand up and be a specialist. You need to have a baseline first, because this is about protecting the integrity of the profession and protecting the patient, the communities we serve. So before we all start getting very excited, let's just make sure that there is that professional competency there. So everybody needs to have that baseline competency they need to have, and then their training needs, and through professional supervision and other means, identify what areas they want to go to. So we have people that are entering the profession directly to specialize in certain areas, and we have people that are entering the profession as generalists. But we need to have a baseline, and it has to be tailored based on local needs. It goes back to what I'm saying. This is about social justice and inequalities, and not just getting excited for getting excited's sake.
Okay, thank you. I tell you what I'm going to do. I'm just going to go through the panel to Gay, and then Esther, you can come back to us.
Lovely. Thank you. Just a couple of points. So the original social prescribing guidance from NHS England encouraged people to develop a shared plan for social prescribing, to work across all the partners. And I think with the new integrated care systems, it gives us a level that we can really take this up. If we can get health, local authorities, voluntary sector, all of the key bodies, including the, you know, nature and all of the partners together, to really look at that social prescribing workforce across the piece and how we develop that workforce across, and look at the population health management needs, health inequalities information, and design that service, you know, the service, and work together collaboratively. I think that's really key, as well as looking at the activities. And I think the second point is exactly what Christiana said. You know, we're developing this workforce development framework to give that sort of context. You know, what are the core competencies of social prescribing link workers, regardless of where they work, regardless of who they're employed for? You know, what are they? And then where are the specialisms, and what additional expertise do you need to grow out from that? We've got Jo Crease here today. She's from my team. She's leading that piece of work. Great person to talk to about this. But I think,
Can we ask Jo to wave, and then if anybody
wave, Jo.
Stand up, Jo.
Oh, she's virtual. Sorry,
Right,
Jo.
okay.
She'll wave from Brighton. That's brilliant. But I think we're seeing, for me, there are two things at NHS England that we're doing to really sort of be able to hang some things on. One is the workforce development framework, and then we can build out from that. The other one is, which will be coming soon, is a maturity framework, which really sets out for ICSs some of the key things that need to be in place to help social prescribing thrive. So workforce and activities, and really taking a more strategic approach to social prescribing.
Okay, so you can hear, can't you, that there's lots of things in the pipeline. There's lots of things just either being launched or just being launched or in the pipeline, and together they make a package. Harminder.
I said I'd get that apprenticeship title wrong. I've got the correct title.
Go on, go for it.
Community and Wellbeing Worker. So this is what Christiana was saying. What's the basics? What's the fundamentals? And then what Nick has said, actually, what's the ICS plans? What's the population health needs? Because I'm from Leicester. It's going to be very different, my requirements and the population of Leicester to, you know, coastal towns. So I think it's about getting those fundamentals, but absolutely looking at building on that with the framework in terms of that specialisms. And I don't want to repeat anything else that colleagues have said.
So the community wellbeing worker apprenticeship feels really important to me because it's about people who've been through social prescribing, who've benefited from it, people who might not have done all those educational qualifications, but have got fantastic support skills. It's about enabling them to be part of it. And I think that's fantastic. So thank you. Gay.
Yeah, so also at the moment in Southwark, we're also working with one of the financial organisations. So we're actually part of one of the Financial Shield programmes. So it's actually with Citizens Advice. So the link worker is financially and has the skills and knowledge, and they're merging the two roles together. So their financial skills, their debt management skills, and they're now bringing in the social prescribing side. So we're actually working together. So it's really about collaborating with all the other major organisations. It's how can we put the social prescribing element into this? Because ultimately what we're saying is social prescribing can fit anywhere, but it's really about using the core foundations of social prescribing and adding that extra niche, which is that specialist side. So they've got that specialist knowledge, but ultimately the social prescribing element, the empowerment, actually the social justice, really bringing that evidence along is where the common core foundation and what we're doing from this side actually works. So we are starting to see it. We're looking at working with hospital teams and the cancer teams and the learning disability teams. So again, it's all about using their skill of the specialists, but actually amalgamating and really merging it together with the actual core role of what social prescribing is all about.
Okay, thank you. Esther, you sounded like you might want to come back to us.
I was going to say, I meet lots of social prescribing link workers in the course of my week, and they're amazing people. They've got amazing skills. They've often got masses of experience in the community, and they're bringing that, and within their own teams they're sharing that expertise and developing it. But so I just want to say I really understand. I just really respect them, and I'm really pleased that they've got this stuff, that they will have that building block to bring those experiences to the party as well. But it's going to be the specialism. And just to say, I'm really, really excited to see the children and young people's workforce development, because it's especially interest in mine. So thank you very much.
And thanks for your leadership with children and young people as well, Esther. Really appreciate it.
Okay, thank you. We are running out of time. The worst thing that somebody like me could do is keep people from their lunch and from whatever is happening next. However, we have got one really important job to do as a panel, and that's to say thank you to the new student champions who are in our audience today, and to give them one of our lanyards just to say, hey, you're a student champion. Thank you for your work. So I'm going to ask 6 people to come up. I'm going to ask you to come and come to the side and where the steps are and walk onto the stage. I'm asking Wenton and Nabil and Mary and Veronica Falloy and Katie and Vanessa to come up, please, because we'd love to celebrate your work as student champions. Come and stand with us. So, just to get the logistics right, each of our panel are going to give you one of these lanyards to say thank you for your support for social prescribing. We're really excited about your work with us, and we're looking forward to hearing more as we go along. Thank you for being our student champions. Okay, yeah, just come and stand with us. Just come and stand to the side. That's brilliant. Really appreciate you being up for coming on the stage. We'll have a photo in a minute, but I just want to conclude this session. Gay, is there anything you want to say just to finish this off Thank you for working with us on this, and we'll let these lot go and do their next thing in a minute. But last word from you.
My last word is superheroes don't always wear capes. So remember, there are the link workers, and the most important thing about link workers is it's really simple. Each one can reach one. So if each of us go back and talk about link working and the role, we can increase the work capacity by no ends. Thank you very much for your time. Thank you.
Oh, brilliant, brilliant. Thank you so much. Not all superheroes race. I like that. I like that. Not all superheroes wear capes. If we can give them one more round of applause, they make their way off the stage. But thank you so much for your insight. Thanks so much for your input.